If you're anything like me, you need to see things before they actually make sense. So let's take a look at some of these ventilator settings that you're going to need to know before setting foot into the ICU. So the settings down at the bottom of the ventilator is what the ventilator is programmed to do. So I want you to look at the very far end where it says AC plus VC. This is assist control and it's a volume control mode. So this is the actual mode that the ventilator is programmed for. The very next number that you're going to see says F, and that stands for frequency 16. And so that means that the ventilator is programmed to deliver 16 breaths per minute. The next setting is VT, that's tidal volume, and it is set to 350 in this particular ventilator. So that means that the patient is going to be getting a preset amount of volume set to 350 centimeters of water with every breath. Moving over just a little bit, we're going to skip a couple of those other settings. I want you to look at O2, where it says 50%. This is the programmed FiO2, or fraction of inspired oxygen. So this patient is on 50% FiO2. Directly below the FiO2, it says PEEP of 5. This is positive end expiratory pressure. So this is that little extra push of pressure at the end of exhalation to help keep the alveoli open and prevent them from collapsing. Keep in mind that these settings are programmed with a few parameters taken into consideration, and that includes the patient's gender, the patient's height, and the patient's ideal body weight. Now I want you to look at the top of the picture where it says A. The very next number beside where it says A, it says like F total, and it says 24. So this means that the patient is actually breathing 24 times a minute. So this patient is initiating spontaneous breaths on their own over and above that set rate of 16 breaths per minute that we programmed into the ventilator. All the numbers up at the top of the screen are going to vary with each breath because all those numbers represent what the patient is doing on their own, whereas the numbers at the bottom of the screen that we talked about represent what is programmed into the ventilator, and those numbers are not going to change. Follow for more. Go Vols.